Great. Maybe we can start off with introductions, starting with Wendy and trickling down.
Yeah, happy to introduce myself. Hello, everybody. Good to have you. I kind of was hoping they were going to leave on the music. It sounded pretty cool, like club music. Anyway, Wendy Nickle. I'm the Chief Program Officer at the Science Center here in Philadelphia. And I have a number of programs that are under my portfolio, all the way from STEM education in middle school and high school to working with early stage companies on getting their programs and their products off the floor. So happy to be here and excited to be part of the panel.
Awesome. I'm Noah, the CEO and one of the co-founders of Ritten, and we're a behavioral health, medical records, and practice management software platform based here in Philly. The name is an homage to Rittenhouse Square, as well as record-keeping software. We've been around since late 2020. We work with providers nationally as their core system of record for scheduling patients, taking notes, and generating claims.
My name is Tim O'Malley. I'm from Independence Blue Cross, who is the local Blue Cross and Blue Shield. And if you live in Philadelphia, you cannot escape our ads. My apologies in advance. I'm in charge of all of our infrastructure, cloud, and IT operations.
Hey everyone, my name's Manasa. My North Star has really always been working with startups. Was a part of this really interesting artificial intelligence laboratory that was a collaboration between Ray Dalio and Weill Cornell Medicine, and out of it spun this health tech startup that I worked for, again, between their Series B and C, and for a few small venture funds before joining JP Morgan. So really excited to kick off this panel with people who relate to AI and startups in a lot of different ways. We're going to begin with easy question. So what is one trend in health tech that you believe is reshaping the industry? And it could be anything as broad as AI in general, or something that you have seen that is recently really picked up. And we'll start with you, Timothy.
I can't start anywhere but AI. I don't make it 5 minutes without having a conversation with someone like Noah, someone like Wendy Glean, who's outside talking about how AI is shaping the industry. From cutting down to the time that our nurses and care folks have to spend to review a case and get the notes together, to helping kind of reduce the barriers to entry for care for folks. It really is, over the next 2 to 3 years, going to be the biggest trend to help get access to care for people.
Yeah, we certainly see the same thing. You know, one of the things we see is like medical records are primarily narrative text in, narrative text out, and so there's just a ton of opportunity to provide real immediate value with these tools. I would say, aside from that, a couple other things we see maybe the last few years before this is telehealth, especially in behavioral health. Like, how can we provide behavioral health treatments, specifically substance abuse treatments, to people that can't make it to a facility every day? So there's been a lot of interesting stuff there as well. And then, the thing we're always chasing, value-based care and behavioral health. Can we decide what good outcomes look like, and then can we work with payers to get reimbursements based on those outcomes versus just services provided, is something we do see more and more of now with our customers. But I mean, certainly AI is the hot one that we spend a lot of development time on.
Yeah, I think AI is truly a disruptor. For all of you who've been in healthcare in the past, 50 years or so, there really has not been a moment in time like there is now with AI. AI is really speeding issues like clinical decision support. So being able to take a lot of data and transform that into the way that clinicians are making decisions. I think also, as we think about workforce burnout in the healthcare space, a lot of it is related to administrative tasks. And so there's a real opportunity for AI to help cut down on some of those administrative things that really take clinicians away from being able to do the important patient-centered work that they really want to do.
Incredible. And Noah, maybe we'll start with you for this question as it relates to Ritten. As we move towards more personalized data and data-driven care models, how do startups and how should institutions really be thinking about this? And what are you particularly doing to make sure that you're being careful with infrastructure and data and privacy and security?
Yeah, I think for us, as a tech provider to these programs, these behavioral health programs, security, data security has always been something that we've been concerned about. So that doesn't change for us. I think one of the things we have to be careful of is with so many new vendors, both application layer vendors, but also infrastructure vendors that we want to work with, there's a certain level of diligence required on our end. They may say they're HIPAA compliant, they may sign a BAA, but a lot of these places have not been around very long. And so one of the things we ask ourselves is how can we get confidence in their controls that they meet our standards? Because there's so many startups providing services even to us. Our providers never see them. And then also need to make sure we give confidence to our providers that we are doing that diligence. And there's like this whole chain. It's just, the chain has always existed, but now every company in the chain is 12 months old maximum. And so there's just another layer of diligence that's required on our end and on the provider's end.
What's interesting is also the time it takes to have those certain compliance check marks where it's SOC 2 or HIPAA or high trust is expedited because of AI too. But
yeah.
Timothy, I know you were about to jump in.
No, I was going to say, I think to your point, the vendor piece of it is the hardest part because we don't know who these sub-vendors are. So we've gone through a whole extra process of trying to vet them out and figure out what that is, but maybe a little bit higher than the kind of initial startups for us. We always look for a vendor who we can deploy in our environment rather than having to go out. So having the ability to be kind of platform agnostic a little bit and be able to bring your service in-house to our data center or our cloud really gives us the confidence that we get that extra layer of security on top of it. So I think once you get to where Noah is or something like that, you can kind of move to that level and give us that extra clarification because our audit folks really are nervous about any web or cloud-based companies at this point.
That makes sense. And Wendy, at the earliest stage, is that something you're thinking about when you're working with startups?
Absolutely. That's part of the due diligence plan is really thinking about cybersecurity and, really restrictive access to data. So from a HIPAA perspective, but also from an internal control perspective. So the startup should be thinking about kind of 3 tiers of data. You've got public data that's sort of, CMS data or whatever is out on the government websites. You've got your internal data, which might be your financials and things like that. And then finally, you've got your most restrictive tier of data, and that's what you have to be thinking about and worried about and what you should be building for. The other thing, thinking about with startups is really cybersecurity, making sure that your vendors have the appropriate amount of insurance and that they've done all their due diligence with regard to protecting your assets.
Incredible. The next question is sort of touching the global macroeconomic climate. I think that there's a lot of uncertainty in the world right now and funding models are evolving. What signals are you seeing around how health tech is being financed? Have you seen anything really interesting or what should founders be prepared for? And I know each individual will have a unique perspective on this. Maybe we can start with Timothy.
I was hoping we were going to get to Wendy first. I think with the volatility, I think we've worked with Wendy and company with a lot of startups. We've been much more, it seems much more selective in our process of who to fund and what ringers we put through, whereas 5 or 6 years ago, we were really looking to fund as much as we could. So I think there's been a tightening in the market from folks like us who are doing the investing. So I think that's, I don't know if you've seen the same thing in the relationship, but it's certainly where I sit, what I'm seeing at this point in the market.
Yeah, I think what we're seeing is, first of all, there is still funding out there. I know it's very volatile, but there is funding from both a government perspective through things like SBIR and other granting activities. And investors are investing, but they're really looking for companies that have good teams. We're seeing that a lot, that they care about the leadership. They care to show that the leadership is going to be resilient and able to kind of manage these waves that are, very disruptive and kind of evolving over time. The other thing I meant to say before with regard to data security was GDPR, because I think that plays into a lot of this, thinking about tariffs, thinking about if you're working with global companies, what is that compliance with GDPR? What does that add to your expenses? So, really keeping in mind all of these issues are incredibly important. And going back to due diligence, that's what investors are looking for, that you've thought about all of these issues.
And I would say for us as a company that goes out and raises money, and so we've done a couple of venture rounds, and we were actually chatting last week with some of our investors, and the question, we're like, hey, should we do something now because there's so much uncertainty about what the landscape could look like a year from now? And they were like, no, and for a couple reasons. One, they say that there's still money out there for good companies. Investors still are investing. There hasn't been a freeze like even what there was in 2022. But there's a couple caveats. One, I think traditionally investors have been more patient with health tech companies in terms of their growth trajectory because they know that these providers are slow to switch. It's a stickier product, but there's like almost like a health tech reverse premium where you can get away with a little slower growth because you have the story. I think that a wave of AI companies have sort of thrown this away, and frankly, the growth metrics that you need to raise a competitive round are actually much harder than they were because some companies have just grown so quickly. Remains to be seen how defensible those are, but the standard has been raised as far as metrics, even in health tech, which historically had some leeway. And then there's also an AI premium. So you just have to position your company as an AI company in some way, and it'll double the valuation. It just is what it is. Is what we've seen. And somebody is a system of record. That's something we're looking at. How can we position ourselves now? Because we do leverage these technologies. And then the third thing I would say that we kind of have back of mind that we haven't seen manifest in the market, but does keep me up a little bit at night, which is like, are there going to be big shocks on the payer side? And is that going to impact providers? And it's going to impact providers' ability to, work with us as a vendor. So not yet, but something, that we're certainly thinking about as we look at what our providers are able to pay for.
Thank you. Really helpful perspective, especially from your investors. Equity is a critical issue in healthcare. What innovations are you seeing or are you building that truly address access, affordability, and inclusion in care delivery models? Wendy, maybe we can kick off with you.
So my background is public health, so this is something that's very near and dear to my heart. But we're seeing some really interesting innovations that are out there. There's actually a company that we're working with right now that is looking at Medicaid and how to reduce fraud and abuse in Medicaid. And the way that that's going to help providers is allowing them to look at eligibility and verify eligibility quickly so that then they can get the benefits to the appropriate individuals. Another, really great company that we're working with is using community engagement to enroll underrepresented individuals in clinical trials. That's a really, fabulous organization. So I really think that a lot of the AI technology and a lot of the other tools that are coming up are going to really speed the way that we can serve underrepresented, really improve disparities in equity. I think the challenge that we have to look at is what is the data that's being fed into some of this machine learning. If we're not feeding, it's garbage in, garbage out. If we're not feeding good data, it's, that's going to be problematic in the future. And we've seen that for any of you who may be familiar with race-based algorithms, we know that this data was built to create care processes for individuals in a way that was really very damaging to certain populations. And so we have to make sure that we have ethics in place and we have the right way to look at the information and the data so that we don't go down that road in the future.
I would say, what we see internally is we're able to support a lot more languages more easily in the application, just because these tools are very good at translation, and they can, a scribe tool can easily support multiple languages now with just a simple prompt change. So that's one way, very immediately, as we have now customers even in Mexico, and we have customers that work with refugee populations, and we can create our forms in other languages very quickly, which has been exciting for us. Other things we see out there, just on the behavioral health side, is like I mentioned before, trying to deliver care to populations that don't have access to more acute care, and that's been a big focus. So methadone, at-home methadone dosing has always been really hard. There's a lot of interesting companies working on that program. And then providing more acute level care in a remote setting has been something we see as well. So a lot of that for us, besides the language thing, has just been reaching really rural populations that need these services as well.
Yeah, and the language thing has been huge for us, being able to reach a population that does not use English as a first language has really helped us reach a larger population of our members where they are and do document translation, form translation much quicker. If they call into an agent, we can do those things much quicker and provide the information to the agent in the language they're speaking rather than them having to translate in their head the English language to that member and make sure that they're communicating back and forth. So it's really helped us with that.
Incredible. And Noah, maybe we can start with you for this one, and you can talk about what has worked for you or has worked for your peers. Is how can startups and maybe more established entities better collaborate and bridge gaps in innovation, regulation, scale? How are you thinking about partnerships in general?
So I think for us, one thing we can do a better job on, and what would be really helpful for us as well, is, as a startup, you don't have anybody's ear. And so we'd love to talk with payers and say, hey, what do you really care about in these notes? We live in a world of provider mythology where I need to have this, that, and the other thing, and it puts these whole workflow burdens on them. But we'd love to communicate more directly with the payers and say, what's real? What do you really care about in these notes, so we can make sure that providers are focusing on that and we guide them to that. So I think as a startup, engaging with large corporations that provide the backbone of the health ecosystem in a number of ways is very difficult. It's something we try to leverage our investor network to do. We could probably do a better job being proactive about it. But if I were to say, how could larger entities help us? It's find ways to engage with startups, systematic ways to engage with startups, because, it's very hard for us to get them on the phone and to talk with somebody who will give us the time of day to help us build the product.
Wendy?
So I think what we're seeing in the healthcare ecosystem in Philadelphia is that it's very hard to gain entry into a hospital, whether it be for a pilot program or a clinical trial. And I think what we're learning is that one hospital is one hospital, and they don't all have the same point of entry. And so we're really trying hard in support of our startups to figure out what is the point of entry in different organizations. In some, it may be their innovation lab. In others, it could be, a clinician champion that is really eager to do something. I would recommend, as a startup, to really identify what the priorities are for the health system. And there's a variety of ways to do that. It could be through the Community Health Needs Assessment, which sits on every hospital's website. It's typically a report of all the data in the region and how that hospital is or is not meeting the needs of their population. You can look at other resources that can support, identifying priorities. But I think that's really important, is to align with the priorities and then, try to identify a champion.
I think, to Noah's point, I think it's, for startups especially, very hard to get into established payers. People are overrun with that. So I think in Philadelphia especially, the technology world is very small. So I think the biggest thing is to leverage the existing relationships that you have with people. Everybody probably in this room knows someone that works at Penn or Jefferson or Temple, who may not be in the decision-making tree somewhere, to Wendy's point, but they do know someone who is, and using those things to not only find out information about the company, but what their pain points are, because there's probably a lot of them. And I think fitting in that 30 to 20% of this is what that payer cares about, and this is what that pain point is, and that's kind of my entry into that team is really important. Especially for me, I get an email probably every 35 minutes that says, "Hey, do you have 15 minutes of your time to talk to me about your issues?" And I don't, but I would love to if I did. But finding someone who does know them in that org in your social circle is really probably one of the best things that you can do, because it is a small world here in Philadelphia.
Yeah, that's funny. Our benefits gets the same amount of questions, and I think right now, even to be added to their pipeline. It's a date of 2027. So we're looking to do some sort of event with them, best practices on like how to engage employer-sponsored benefits group as a health tech company.
I can tell you for sure that the probably top two priorities are workforce shortage and the other priority is around supply chain. So if you have solutions that are going to help with improving workforce, whether that's shortages or burnout, clinician burnout, and really solving supply chain, I think that those are two very high priorities right now.
Awesome. And if we're sitting here again in 10 years, what's one transformation you think we'll look at as a defining shift in the health tech or life science space?
So, I mean, Noah and I were talking about this earlier, so I'll kind of start off. I think the shift in behavioral health and teledoc and all of those things, the pandemic was a real eye-opening for health insurance companies and I think the world about how important mental health is to physical health. So all of the things that have been taken in that space from the payer side, from the technology side, from the provider side, have really started. I think in 10 years we'll see the benefit of them, hopefully with a slightly people being healthier, understanding that their mental health and their physical health are very connected to each other. So I think that's where I sit right now today.
I think from like a provider workflow perspective, which is where we spend most of our time, I really think that if we especially look at 10 years down the road, there will be much, much less, if any, writing of narrative text and producing of narrative text. I think and I hope that it will be, time spent with patients, and then the notes are written in accordance with what happened in the session. They're coded properly based on the rules that are established, and then they're reviewed automatically as well, and then pending any issues, they go to the payer easily. And I think the number of humans touching that will drastically be reduced, starting with the provider themselves and all the way through from the billers to the utilization review people getting authorizations. I think a lot of those people will come out of the loop, which will be a good thing, I think.
I think tying some of that back into the physical health part of it too, right? Being one whole person health.
Yeah, I completely agree with that. And I think on the clinician side, there's going to be a lot more data that's going to drive care. So it'll be data that's longitudinal and really is not just point of care, but what's happening in that person's, care journey, if you will. And I think taking all of that data in totality and then really being able to treat the patient is what we're going to see in the future. From a consumer perspective, I think we're going to see more proactivity as opposed to reactivity. At least that's my hope. With wearables and sensors and different ways that people can access healthcare today. My hope is that people are going to be taking much more proactive approach to their healthcare.
That's exciting to hear because my husband's working on EMG sensing as a wearable, so good to know. Great. I think we're going to open it up to some questions from the audience that have begun to come in. What is the appetite for doing products that are not AI driven? I think that's an interesting question because AI is definitely the sexy word on the market right now.
Well, we have seen a number of companies come through that are not AI dependent, and I'm going to give you an example, and I'm going to have to act it out a little bit because it's hard to explain. But we have a product that just came through where you get a box, there's a mask, you breathe into the mask, you put the mask back into a box, and you mail it off. And dogs in a lab can actually sniff out cancer to 97% sensitivity.
Wow.
So it is amazing, the technologies that are coming out, and they're not necessarily AI driven, but I think, again, we're going to see real speed to market on these really new and exciting and innovative technologies.
I think, like you mentioned, the hardware side is going to continue to be interesting, like the remote methadone dosing, that's not AI driven. I think on the software side, it's tough to not involve that. And part of that is because a lot of companies have been looking at a lot of these problems for decades. And so what AI provides a software company is an entirely new tool set to solve a problem. So if you're going into a market where there's established vendors, at least in an ancillary way, trying to solve this problem, your likelihood of providing a step change to the extent where buyers will actually buy your product is much, much higher when you're bringing this new tool set to the table, because otherwise you're essentially fighting with the same tools that these people have been trying for 15 years to solve a workflow. So it's such a new set of technologies that allows you to solve problems in such new ways that it's tough to think of bringing a software company honestly to market now and not including that in some way. And that's coming from a company that I would not say we're an AI company. We didn't start as one. But even then, we see it's a great tool to solve a lot of our workflow problems now.
Yeah, and I think that's a really good point, is that you may not look at yourself as an AI company, but you have to be AI adjacent in some way, shape, or form to succeed as a software company today. Whether you're doing some sort of interoperability, you have to be able to bring that into an AI to give them the end result. So I don't think there's a way you can do any sort of software without AI at this point.
Awesome. If I'm a startup in the audience, what is the best way for me to engage with either of you? We can start with Wendy.
Just come up and say hello, or you can link with me on LinkedIn. I will say that my name is not spelled correctly, but it's Nickle like the coin, so Nickel, but you can find me on LinkedIn.
For us, if you want to engage with us, just talk about the startup journey. I'll be around also on LinkedIn, or shoot me an email. Yeah, noah@ritten.io. Happy to chat Philly startups.
Yeah, I mean, the same. LinkedIn is easy to find. You can shoot me an email. My email is also very easy. It's tim@ibx.com. Certainly happy to talk to anybody.
Awesome. And then what is the most impressive AI resource you've viewed or worked with? What is something that you've seen that says that's impossible to do but has been done?
Speak to that because this is fresh for us. We just had a big hackathon last week at our offsite, but there's a lot of tools now that have the ability, previously you feed a prompt and you feed data to a model and then it spits out a result. There's a lot of technologies now, and I'm not a technical person, so forgive me, but you essentially let them into your database to a certain extent and they learn the structure of your database, so you don't have to feed them new information with every run. And so you can ask natural language questions, and it essentially can provide much, much more context than it could in past years. They were context limited before, but it can use the entire context of your database to answer those questions. So as a system of record company like us, where we sit on every piece of data from a biometric entry of a nurse to a progress note from a psychiatrist to an admissions, lead form for an admissions team, being able to leverage all of that data in a natural language way is I've seen some demos of us internally, and it's really, I'm excited for it to roll out into production soon.
I just got back from Google Next, and mine, it's a similar thing, but it's much more simple and it's much more personal to people. It's a Google product, but I won't give them a complete shout out here, but it's a notebook tool that you can dump in a bunch of different data sources and it will contextualize it in under 3 minutes. So I dumped in, I was working on an AI project with our finance team. We tried a couple different, ways of coding it, couldn't get the answers we liked, couldn't get it to answer the questions. On a whim, I threw in 15 documents into this notebook from Google, and within 3 minutes, it was asking me what questions I should ask, a timeline, it had an FAQ, a briefing document, and a 10-minute podcast on the 15 documents I just put in, all in the matter of 5 minutes. So to me, from a financial analysis perspective, we're just, hey, I get a lot of spreadsheets, I get a lot of data, I can drop it in there and get what I need out of that. And I've been using the Microsoft Copilot for years, and it is steps above that from my perspective.
Great, good to know. Wendy?
Well, honestly, I prepared for today with ChatGPT, but I'm kidding. Actually, I've seen a technology recently that is just fascinating. It actually, there's an individual that has ALS and has lost his speech. And the AI is able to actually mimic his voice, and it's also able to mimic the way that he speaks. And so he was able to get up on stage and do a keynote presentation through video that really mimicked the way that he would naturally speak if he still hadn't lost his ability to speak. So AI is just fascinating. Like I said before, it's a disruptor. And I think we're going to continue to see things like that in the future.
And I think the coolest thing that I've seen is DNA storage in lieu of actual cloud storage and the integration of AI into that. If you had to leave health tech and the healthcare industry today, what would you venture into next?
I would go back to retail, which is where I came from. I've flopped back and forth between healthcare technology. I was in clinical trials and worked for a local retailer here, and then came to health tech. I think I would go back. They move a little bit faster than healthcare technology, so I think that's where I would head.
Okay, great.
I think I would go into logistics or moving people and things. It's just super interesting to me. In the medical records world, it's all just words, and it's obviously patient care, but there's not physical things necessarily moving from place to place. So I miss that sometimes, just thinking about how do you actually get something from one place to another. That's an interesting problem set.
Yeah, definitely. When a ship was caught in the Suez Canal, we had shipment delays for months, so.
For me, I'd go back to the hospital setting, which is where I basically started my career. And I feel like that has always served me very well because I understand the sort of clinical environment, also very close to the patient environment and understanding how clinical workflows impact the patient, and then really treating patients, like you said, with whole care, whole body care. And that includes the mental health components, the social determinants of health, as well as the physical components. So that's always been kind of the North Star of my career.
Incredible. And Timothy, maybe we can start with you for this one. What is the best way to validate my startup before reaching out and before we can integrate into a healthcare provider?
I think I'm trying to think of what the best answer for that is. I think, and you might have a little bit better of an answer than I would here, but I think from my perspective, just see. I would even look out there and see what some of the issues you may see from companies that they have, right, that the public sees, and see if there are issues, or figure out where in the market, if there is that gap, then reach out. I think that's the best way. It's hard to validate a startup with a company you're not familiar with. So you may glean a lot more information from the public world about what happens in companies like Independence than you might realize you can.
Noah or Wendy, anything to add?
I think if I've learned one thing from the journey so far, it's that money talks, and so get somebody to pay for your product and use it. That's like the best thing. Second is get somebody to pay from your product and not yet using it. Not as good, but still okay. Third is get somebody to promise to pay for your product, much less valuable, but still better than nothing. And then after that, it's okay, I have an idea and some people that are excited about it. But honestly, if you get somebody to pay for the product or service you're providing and then they use it, which means it's providing more value for them than not using it or than using something else, that's the only truly way to validate it, to some extent.
I think I would make two recommendations. One is customer discovery and doing that early and often. What we find sometimes is that people come in so in love with their technology that they created, but they forgot to ask anybody if it would be useful or if they would actually benefit from it. So I think that's really important early on. The second thing I would offer is there's a lot of programs out there that can support startups in their journey, and I would really kind of do some research to find out what's out there and even talk to other people that have started companies and have been successful.
Noah, this one's for you. Was there any mistake that you made in your CEO journey that you thought was more of a benefit in hindsight or turned out to be helpful in scaling the company?
I thought you were going to leave it the first part, and I was like, oh, I could talk all day. I think, we raised a seed round in 2021, and we had an interesting set of initial customers. And then we thought, okay, we raised some money, we have some customers using the product, let's time to hit the go-to-market and hit the growth button. And we moved too aggressively on that. And it really took us another year of building and trying to learn how to sell it before we really should have invested in the growth at that point. And I think the lesson there for me personally was, up until that point, selling, besides like to our early customers that I had worked for years to build relationships with, it was like an academic exercise, and understanding what like a product market fit looks like was an academic exercise. But trying to find it then, hiring too many people, unfortunately needing to let them go, retrench a little bit, and then doing it again and having a lot of success, you actually feel what product market fit feels like, and it allows you to make much better decisions. I can make much better decisions going forward on hiring because I know what it feels like to hire somebody you're not ready for, and also what it feels like when you need somebody now in the seat. And that is a feeling that I don't know if I could have learned besides experiencing both sides of that.
Okay, helpful. Well, maybe we can close out with a question related not to AI or healthcare, but what is your go-to spot in Philadelphia for a glass of wine, for dinner, or a cup of coffee?
I'll go lunch, my favorite meal. Big fan of Middle Child. We used to be like closer to Rittenhouse Square. Now we're over on this side of town, much closer to Middle Child, which is great.
Incredible.
I would say Mulherrins. I just love Mulherrins. Also, not too far from here.
It's a really tough question for me. I'm going to go a little bit off the beaten path. There's a distillery who's not far from here called Four Humors, and it's two brothers who opened up a bourbon distillery in the neighborhood. So that's probably my favorite place to go.
Incredible. I'll have to check them out. Well, thank you so much, you guys. This has been great and really insightful.